Disclaimer: the content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. And now...
Yeah, we don't want to do anything to scare your children. That's the last thing we want to do. We don't want to scare anybody.
Ladies and gentlemen, please welcome Ben and Amy on Season 2 of The Heavy Truth.
Welcome back.
Hi, welcome in.
Happy Season 2
Happy Season 2.
of The Heavy Truth.
Yes, I'm Ben.
I'm Amy.
Wow, can you believe Season 2?
No, it's been a good run and we're excited.
Yeah.
I'm excited for
I'm so excited.
future episodes and,
Surprised they even let us have a Season 1.
right? I mean,
Yeah.
we definitely have enjoyed the last year, so to speak, right? I mean, we recorded for about, 8 or 9 months. We took a little hiatus over the summer. And, if anyone remembers from last season, so to speak, we were missing one of our, we were missing you, Ben.
Oh, I was missing myself too, Amy.
And you had allowed us to tell everyone where you were and why you were missing.
I don't recall signing that waiver.
So we had an excellent fill-in, and producer Mike,
Yes.
he was
Yeah, there's
Nice.
that.
did a great job
Yeah,
with
gracious enough to step in and
and give us the expertise on his goal setting. And since he is a certified health coach,
Yes,
now
there's
he feels
that.
as though he can be part of the crew, but not sure we're there yet.
We're not there yet.
Yeah. Sorry, Mike.
Yeah,
I mean,
it was just due to a health emergency.
there's no health emergency. You had an elective procedure. Do you want to explain what you had done?
Well, what did you let the kids know that I had done, Amy, since you said that why I wasn't there? So what did you tell them?
I said that you had plastic surgery.
Oh, well, that makes it sound like I had a facelift.
Well,
I mean, I didn't.
I was a little bit more specific, but
Okay.
if you want to continue on, for those who
I
don't
mean, I
know.
didn't have vaginoplasty or anything like that.
No,
Okay.
not yet.
Not yet. I know. No. Yeah. I mean, we've always been very candid, and I've always been very candid and open about my weight loss surgery. The fact that I had laparoscopic gastric sleeve in 2020 and lost quite a bit of weight, like we've talked about. And so then I went and had a consultation with a fantastic plastic surgeon. And I had a paniculectomy with a fleur-de-lis oblique flankoplasty. I know that sounds really crazy to say when I say that, all right?
Yes. And how long?
What should we?
Well, so almost 4 years after your
after
your surgery.
And you had to have. I had so some things like in order to lead up to that, right after the consultation, I had to my weight loss had to be stable, meaning I had been at a stable weight for about 4 to 6 months because no one wants to have any kind of skin removal of some sort and then continue to lose weight because then basically it was for nothing, right? Because you'll have more
Or
excess
gain
skin.
weight.
Or gain weight,
right? They want you to be stable.
Yeah. So, and thankfully when I saw her, yes, my weight had stabilized, my weight loss. And so I did see her and we talked about some various procedures. And of course I had done research, right? And looked at all these different places and that. And then I just went through a surgeon that I knew about and had a consultation with her. And then we discussed some of the options. And
So you didn't go to like Tijuana or anything?
Well, I did.
What's your
Well,
thought
I-
on that? Because I know people are going to ask
So
about
I'm going
that.
to tell you, my thought may not be what everybody else thinks. I actually had a surgery scheduled at a very renowned plastic surgeon in Tijuana, who is not only American board certified in plastics, but also Mexico, certified in plastics. And I did have it already scheduled. And it actually was going to happen in August of this year if I would have gone there. And I had a deposit for it all down. And I already had a consultation and all of that.
And were you recruiting somebody to go down with you?
I was, but she was more fixated on, oh, I could go to the beach and I could do this. And then I had to remind her that we were going to Tijuana and not someplace like Puerto Vallarta. And then she wasn't as excited to go, but was still going to go as a trooper. But I'm imagining it was more just hoping to get some kind of knockoff purses and tacos and margaritas as opposed to helping me recover. But yes, she was gracious enough.
That was very nice of me to offer to go.
Yes. Although you were like, are we flying first class and all of that? So no,
I mean, if you're bringing
no.
a nurse practitioner to help you recover after a surgery in Tijuana, I would expect a first class flight.
That was still a no. But anyway, needless to say, I did not. On the recommendation of some people that I know, and you as well, I had a consultation at a surgeon here in the United States. And yeah, it all worked out.
Let me just tell you my rationale behind that. Because
please.
I know...
No, I'm saying I fully still support anybody that goes abroad to have surgery, provided you do your homework and research the surgeon, research the site, research what recovery looks like, talk to people that have gone to these places, and make sure you're not just crossing the border to some back alley, that we've seen on the news and things in the past that are not places to go. Because no one's going to touch you when you come back here with complications.
Right. That was my fear, right? Because I was just nervous. I'm like, what if something happens while you're down there and you can't get treated properly, or you come back and something is really seriously wrong. Yeah. So that just made me nervous for you. Not that, I mean, I was fine with going.
Complications can't happen here too, yeah.
Well, for sure. But at least you're like in your element, and, you're the surgeons here that had, treated you and everything. Right. So that was just my reservation with it. But financially, it's a big difference.
Oh, yeah.
I mean,
absolutely.
Probably 50% less, would you say?
Yes.
About?
100%. Yes. 50% less, at least for some of these surgeries and the stay and all of the care if you've gone abroad. But I agree. That was a small portion in my mind that was saying, well, what if X, Y, or Z would happen? At the same time, I was also thinking, well, insurance may or may not cover this here in the United States. And I didn't think it would, because it seemed very, like you said, cosmetic. But having had a weight loss surgery and things, my surgeon was able to have my insurance
pay for part of it. Cover it, right?
Yes. And there was a small part of it that I did have that was elective that I paid for myself. But it was, so I had the, like I said, paniculectomy.
So what is that actually?
So that is the panis, right, that hangs down.
They call it like the apron.
The apron, right? It hangs down from the excess skin that you lose. Oftentimes people will have rashes and breakdown right under the skin folds because it stays moist or rubs against other areas of the skin, the legs. People get breakdown or rash. And so,
which is something that should be mentioned to any provider you see, because then it helps you get coverage for that portion.
It does. And so that did help me get some sort of coverage because I did have some irritation and some breakdown in the past in that area, right? And I was always very...
you were probably on top of it.
Very on top of it, right? Making sure I would get, the creams or the powders or whatever. But having that in my chart definitely was something that helped to get covered by insurance. Plus having had a weight loss surgery and wearing, I always wear a compression garment of some sort, right, to help with that. And so meaning like Spanx, I didn't wear Spanx, but I'm letting people know, like a Spanx or something like that. Always is something.
Like some Skims? Did you wear like some Skims?
Yes. No, I did not wear those. But having that documented in the chart by my surgeon also helped that as well. And the fact that I had plastics, that I had bariatric surgery, more than 100-pound weight loss, my weight had been stable, things like that. So, so she put it in for authorization, and I was thankful enough that they did authorize covering the paniculectomy part, and then I paid for the oblique synchoplasty.
Do you have any idea, like, what on average, what just like that portion?
Well, funny you ask that, because the after it was all said and done, and I knew I had already paid the out-of-pocket part ahead of time, so I was expecting his bill should be zero. And of course, before they bill insurance, we all seen these bills that come, one of those, and it came to the house, and I opened it, and it was $87,000. And that was that reaction you just had, that deep breath in, was my same reaction.
Yeah, I mean, you didn't even say, I've never
Because
even
I
heard
thought
this
to
from you before.
myself, WTF,
Yeah.
someone better send this where it needs to go, because there's no effing way that this is I'm gonna pay this, right? Because that's not what I was told. It was all pre-authorized, all that.
Yeah. It was a predetermined cash price.
Predetermined cash price, all of that. And so after everything was said and done and insurance covered it, and I had paid the other part for the elective part, my bill was $69.
So are you saying that $87,000 is something that they potentially could have billed insurance for? Not that it would have been covered, but was that
That's
the
what
charges?
that was prior to going. So that's what was sent to insurance. Yeah. And I only had we can discuss, that I had that overnight stay in the hospital or whatever,
yeah.
but yeah.
Okay.
But it was
so
$80s.
$67 plus what you already paid.
Yes.
Do you have a range of what that type of surgery would cost? I mean, you don't have to say exactly what it is, but people like to know what a range is.
I'm only knowing what I mean. If I take away so I said, my bill was, what did I say, like 89,000, right? 87,000.
Yeah.
So when I take away what I paid out of pocket for the elective part of the surgery, which was the flankoplasty, the paniculectomy then would have been about 75 to 80,000, which is what it would have gone to insurance. Because I'm going to be upfront, I paid $7,500 out of pocket for the paniculectomy.
No, for the other one.
Oh, sorry, for the flankoplasty. Yeah. Mm.
Which, I feel like that's a decent price. Yes, it's still a lot of money, but and I think that's a lot of times people's fear, and appreciate you being transparent and, honest with how much things are. But people never want to talk about how much did this cost, you know? And I've had friends that have had, breast augmentation, and I've had some that, mine was $4,000. Now these have been in the States.
Yeah.
Mine was $4,000. And then I have other people that, mine was $19,000. It's like, what is the range?
Yeah.
It's crazy.
Disclaimer: the content.
Some of the people, they are, I don't know, they go to different surgeons, and I think there's a lot of upselling with it and everything.
Of course.
And it's cash, so they can charge whatever they want. It's considered cosmetic,
But you know what? That range is the same when I was looking at the places abroad that I was going to go. Even the surgeons at the same clinic, the prices ranged. From
of course
$10,000 to $15,000, blah blah blah, and it was
It's definitely a good industry to be in, for sure. But at the same time, there's a lot of probably. Not malpractice per se, but I'm sure there's a lot of things that can go wrong, so they have a lot of costs with that involved. But you pay for what you get,
Exactly.
with a lot of things. So, what are some other surgeries that people after extreme weight loss could do to help with their physique?
Yeah. Well, the biggest is that paniculectomy. I think that's the most popular one, right? Where they just go, it's like hip to hip, right? Because they want to get rid of that pannus that's hanging down the apron, like you said. Then there is like a 360 torsoplasty, right? Then they go all the way around.
And that just kind of like
and it's basically like pulls it up.
Like pulls up your drawers.
Pulls up
what
your
I say.
drawers, yeah.
Yeah.
Helps, they get rid of the excess skin in the center, right? And it's pulling it all up so the butt's not as saggy and brings it all together.
And there are some people, which I'm sure, you've seen too, you have to go in and have surgery to repair like the muscles of your abdomen.
So I had the muscles repaired.
Oh, you did?
I did. That's the torsoplasty part, the oblique flankoplasty, and it's all part of
the
that
obliques.
together.
Okay, yeah. So
Yeah.
so some people, and I even see, even in practice, but I do follow some groups on social media as well. And sometimes you'll see people that they just have these huge belly, right? And I mean, I know what's going on, but a lot of other people don't. I mean, they just have no muscle tone,
Right.
like at all.
It happens
So-
when people are pregnant as well, that muscle tone. That's why people have that mommy makeovers, right? And it
Absolutely.
brings
And
it back
once they
together.
bring all that back together, you know, it's just there. But then other people, you know, they've had kids and
It goes back
babies.
because of how they were before.
Maybe, yeah. I mean, maybe. I mean, but again, you just once they tighten that all up, it's like, you
Yep,
know,
I can
I'm
tell
good.
you. So I have that tightness all the time. And I did ask my surgeon about it, like, what's the deal with this? And she meant no, and she told me she meant no, nothing negative. She said, but because of the fact that I've been overweight my entire life, my muscles have been stretched out. So I never knew that feeling of like holding in your tummy where you feel that tightness. Her words were, and again, she meant no offense, that people that have not had that large weight gain like this and the muscles are stretched always have that tightness feeling, but they don't realize that, right? Because they don't know any different. But because I knew different, so I'm sitting here right now, I feel like I'm holding in my stomach, but I'm not, right? So in my mind, right, because we talked about that body dysmorphia, I still feel like I should be letting the gut out like, oh, you know, when we all have done that. But it doesn't happen because now the muscles are all back to where they should be and tightened. So, yeah.
Okay. Is there anything that you would do additionally to what you had done?
I think, you know, having had the surgery that I've had now, I would also maybe people will do when you know people have the excess breast tissue, right? So they'll do that cut underneath and do that and kind of
Yeah.
pull that together
I mean,
as
you
well.
don't really have that
No,
issue.
but some people do. Have
And I'm
that,
giving you a
know.
little kudos there. I mean, I always
Yeah.
like to pick on you, but
Yeah.
I would say if you got a little man boob
I
going
love your
on.
tits, Bren. They're great. They're great tits.
Thanks. You
Oh,
know,
Jesus,
there it is.
Mike. I mean, that it's a true thing that you have, like, I mean, we call it gynomastia,
Yeah,
right?
gynomastia.
You don't have that, but I mean, I guess there could be maybe a little liposuction.
So
or
I had
just-
liposuction in with this because
Oh,
the pubic mons area, right, is what we call the people are just going to say it, right? Fupa. Everybody
Yeah.
knows when you say it that way, right? So with this surgery, right? Because they pull everything up. I had some lipo done to take off the excess fat right there too. So that way there wasn't that
so right above the genital
right
region.
above the genital region. Yeah.
So
right.
to make it less puffy.
Yes, less puffy and less, yeah.
Yeah.
And
Okay.
it basically, and this is going to be very, I don't know, they basically hyped everything up so the peeper's in a higher spot, right?
Yeah. I mean,
than
but
what you're used to.
because everything just kind of falls.
Yeah, yeah.
Right?
Yeah.
Okay. So, I mean, other surgeries after, like plastic surgeries after weight loss surgery, arms,
Arms, thighs, breasts.
breasts, back. I mean, even back. Now, you said
Back,
yours
yeah.
kind of went a little bit around your back.
So the oblique flankoplasty doesn't go a complete 360. It goes very close because you've seen the scars, but it doesn't go a complete 360. And there's less tension, so there's less chance of the incisions opening or thickening of the scars, you know, widening of the scars as my surgery. Because I'd asked, because originally in my mind, I wanted a full 360 because I wanted, you know, pull the drawers up so the ass ain't sagging, right? And stuff
But
like
that
that.
it did. Anyway.
To a point, yeah.
I mean,
Somewhat, yeah. I mean, of course, you know, in my own mind and being a gay man, I'm like, pull that shit up higher, right? But yeah.
how was recovery?
So recovery is again, it's individualized, right? It all depends. The biggest thing I can tell people about recovery is making sure you're getting your proteins in, right? So my surgeon had me drink 3 high protein shakes daily for 7 days prior to going into surgery. And then I continued to drink them for a week after surgery. And recovery for me, I think on a scale of 1 to 10 with pain, because they had me on gabapentin and I think some like Toradol that I could take at night, something like that.
You stayed overnight one night.
I stayed overnight one night,
Mm-hmm.
yes. But I had to sleep on a 60-degree angle that first night. And then for the first 8 weeks post-op, 6 weeks post-op, I had to sleep at a 45-degree angle on my back so there'd be no tension on the incision across the front because it's basically like a C-section scar. And I slept for the first week in an abdominal binder. And then when I saw the surgeon, they removed all the bandages, cleaned everything up, taped off all the HIPAA and all that stuff. And because I kept my protein so high, my entire incision, all of the incisions were completely closed.
Did you have drains?
I had four JP drains in place. If anybody knows what those look like, they basically look like a tiny they look like a hand grenade on a long tube. And they're a pain in the ass because you are now trying to shower while holding and safety pinning these hand grenades, right, Mike? Like juggling oranges. But you can't face the shower head because they don't want it right on your skin. But at the same time, you can't stand completely straight up. So I had to walk slightly stooped over for 6 weeks because I don't want any tension on that skin. And then after coming out of the abdominal binder, I had to wear what they called, I don't know, do they call it, how they pronounce it? Faja, right?
Yeah.
But mine was 2 pieces. And it literally went from knees. The bottom piece went from my knees up to my nipples. And the top piece was a shirt that went from my shoulders almost like 3/4 down my thighs. And they were a tight compression that I wore for 6 weeks.
With eyelets,
right? Oh yeah, that was the best part. So it had eyelet clasps up each leg and down the front. And then it all zippered together.
And the back, too, right?
Yeah. So if you imagine when you suddenly have to go to the bathroom, you literally have to take all of this off. So there were multiple times that I thought I was going to shit myself because I couldn't get this off fast enough.
The texts and phone calls, hilarious.
Yeah,
I couldn't even.
Yeah.
So funny. It was hilarious. How long? 6 weeks you were in that?
6 weeks. 6 weeks.
You didn't complain one time to us about
Beauty
the
is pain, Mike.
Like, you didn't complain about the pain. I was very impressed by that.
Yeah, beauty is pain.
I get it.
Yeah.
And I will say that too. You did very well. And
Yeah.
I mean, you even called me a couple hours after. You were in surgery quite a while. It was a lot longer than I anticipated, actually.
Yeah.
And then you called me a couple hours after you got into your room and you were a little loopy.
Yeah,
but
I don't remember the phone calls to several people until the next day when my husband told me that he threatened to take my phone away because I had called several people. And I remember calling because I had asked my husband when he was looking at the menu for order something for food. I wanted nachos. I mean, he told me this and I couldn't get nachos. And I accused you because you have helped me with my weight loss. I accused you of calling the hospital and putting me on a bariatric diet. And I literally said to him, put her on the phone. Did she put me on some kind of goddamn bariatric diet? How dare she?
I mean, maybe.
And it wasn't because it was a general diet. But yes, I guess I called you. I called my brother. I called another coworker, 2 other coworkers. Yeah.
I mean, you were great. I mean, you were funny. Like, there was no issue, but you were hungry. And yeah, you definitely wanted specific things. It was funny.
Nachos and Starbucks, my husband said.
Yes.
Which I did not get either that night, by the way. I guess you talked me into a chicken Caesar salad.
That was good.
Yeah.
That was a good choice. And you're like, it'll do, Amy. And you did call me while you were eating the Caesar salad.
And dropping it down the front of my
it was going down your
hospital
gown. And you're like, oops, all right, we'll get this. And you're just, picking
fishing it
up.
out and eating it anyway.
It was hilarious. Yeah. We see you remember like that conversation.
Well, I remember that because my husband told me that. And I kind of, after he told me, I was kind of reliving it in my mind. But funny little story, because Mike just asked about that. And I said, beauty is pain. The nurses in PACU, where you go to recover from surgery. So recovery, people will call it recovery. In the hospital, we call it PACU, right? Would wake me and say, Mr. Ramirez, what's your pain? And we always, we ask a pain scale 1 to 10, and that's how they can gauge what medication they're going to give us. And I wouldn't give them a pain scale, and I just kept telling them, beauty is pain, beauty is pain. And I wouldn't give them a number, apparently. And I didn't realize
Who told you this?
So the only reason I know this is because the next morning or when I came out, remember it, one of my coworkers who's good friends with some of the PACU nurses, she came in and said to me, "How are you doing on pain?" And I said, "Fine, I got this." She said, "Beauty is pain." I said, "I know, right?" And she started laughing. And I was like, what are you laughing about? And then the surgeon came in and her first assistant came in, and then they told me that I refused to give the PACU nurses a pain rating, and I just kept telling them beauty is pain.
Why does that? It doesn't surprise me with you being just.
Yeah, it doesn't surprise me now after I hear that.
That is
Yeah.
hilarious.
Yeah. But yeah, so recovery, like you said, I guess it's all patient dependent too in what you do, right? So,
But for you, like on a scale from 1 to 10 being terrible, like for the first week, would you say?
I would say it was maybe a 4.
Yeah.
Maybe that. And really the pain was only when I would have to like get up where I was using the abdominal muscles,
Yeah.
right? But I was wearing that compression garment, so it was a bit less, right? And I would try to sit down really slowly, and you're on a restriction from lifting, and
I'll have to
and dressing changes.
for sure. But I mean, I talked to you multiple times a day during that first recovery period, and I was very impressed with how you handled everything. And not that I was expecting you to be like this whiny, like
Mike would have
diva.
been. Yeah.
But you
You
handled it.
expected the diva part, just not the whiny diva part.
I mean,
Let's be real.
I still did get a little diva-ish, but I'm like, I'm just so impressed that there's really not, like, he's really handling this very well. Now, again, like you said, people handle pain differently.
Yeah.
But there's some people that there's going to say it was a 15
Oh,
on the
100%,
scale. And then, you were like, like 4 or 5. Like, yes, it was uncomfortable, but
Yeah, and it was real,
not intolerable.
But see, I had done some research and all of these things, and I'm on Facebook groups and blah, blah, blah. And people had always said, day 1, everyone feels great because you're in the hospital and you're getting meds. And day 2, you're still okay because you're going home, you got these meds, and that day 3 is the worst. But you know what? I felt like there wasn't that worst ever for me. I felt like it just was good each day, and it got a little bit better.
How long did you take off work?
So I was off. So the first week I was completely off work. So 7 days, right? And then the second week I was, I did my work virtually, and then I was back to work after 2 weeks.
So,
I
like,
guess it's all dependent, right? Like
of what you do
of
for a
what you
job.
do, right? Like if I worked in construction, it would have been like no, it would have been longer, right?
yeah, right. So they allowed you to work a couple weeks, remote, so desk-ish, right?
week.
I mean, 1 week.
1 week.
Okay.
I chose that. I could have
Right,
probably
not
worked another
allowed.
one, but
I
yeah.
used the wrong term, but I mean, you took that time off,
Yeah.
and you were doing remote, visits or whatever. What would be some tips or pointers for people if they're considering having this done from your standpoint?
Do your research, like we talked about. Lots of water, lots of protein. Follow what the doctor says. Wear your compression garments. Take your pain meds if you have them. And don't overdo it. I made sure that I was always walking kind of bent over, wearing the compression. I did everything they said because I wanted the best possible outcome for myself, right?
Yeah, I mean, you're a good patient,
Yeah,
and
yeah.
there's good patients and there's bad patients.
yeah.
So it definitely helps your outcome.
Those were the number one things. And I think the biggest thing was with wound healing is that I always drank or ate, whatever, kept my proteins high. And then I made sure that I would clean things good and rebandage them, and always wear my compression garments. I could take it off for an hour every day. And I did that, to shower and to use the bathroom or something like that.
You're not wearing them anymore.
My compression garments? No.
Are you happy with the results?
Oh, yes. Yes.
You
Yeah.
do it again.
100%. I would do it again. Yeah. I would completely do it again.
Yeah.
And I'm back to the gym. I mean, I went from my heaviest weight at one point, I was at a size 56, 58 waist. After my bariatric surgery and everything, I got down to about a 36. And then after this surgery now, I wear a 34 slim as a waist. So something that I couldn't tell you I don't ever remember wearing, because I remember I told people this when they ask, and I'm very upfront. When family, friends, patients, whoever ask me, I'll show you scars, I'll tell you about it, because I want you to see a realistic impression of how life looks post-bariatric surgery and skin removal surgery.
I haven't seen you in a 34 slim.
I'm wearing a 34 slim right now.
Oh, really?
Yeah.
Okay.
So you did, Amy, on our recent trip, which we'll talk about later, everything I wore was a 34 slim.
Oh, it was much better. Yeah.
Because I know you used to accuse me of having saggy ass pants.
It was just, everything was too baggy. But again, that's like when you are overweight, for a lot of many years,
you don't want to see, anything.
No, so you
Because
just
you
always want
see
to wear
your
things
own.
big.
But I'll tell you, here's one thing I learned even after all of this, Amy, all of this, because my patients and my friends and everyone tells me, oh my God, how good you look, everything. You still don't see yourself that way. I see myself as thinner, but I still look in the mirror and I see obese. I still see, and technically, according to my BMI, I'm still considered obese. I'm a BMI of 30, and I'm still considered obese. And that's.
But how much healthier are you?
Oh, so much healthier. I mean, I went from 420 425 at my heaviest weight to 215.
Right. That's huge. Those
Huge, literally.
Yeah, but those statistics are. That means a lot more to me as a provider with
100%.
my patients than saying, all right, I'm of normal weight. And I hate BMI.
Yeah. Oh, I do too.
guarantee you, if you got on your body composition machine that you have, or, come down to ours and do it, your BMI, you are probably healthier than what your BMI is showing that you are. Absolutely.
Oh yeah, because I get on my scale at home, right? I'm looking at that scale, right? I'm not looking at, and I no longer am fixated on what my weight needs to be, what my weight should be. I changed that mindset. That scale for me doesn't control how my day looks or anything looks, right? And that's the biggest thing is I'm happy with how I look. I'm happy with the results. I think my surgeon did an amazing job. Jokingly, when I saw her and she had said something about how amazing I look, and I said, well, when you have when you have a good subject and you have a good artist, you're going to get the Mona Lisa or the David, right?
Of course she said that to you.
I said that to her.
Oh, of course you did.
And she just kind of laughed.
It would have been kind of funny if she said that to you, though.
The biggest thing now is running into people that I know and they always are like shocked. I think that's really exciting. Yeah. And fun.
I love that. I mean, I know this was a topic that people had inquired about, numerous times, and it just worked out that you had this done, and I knew you were going to be open about talking about it. So. Oh,
and my gym crush has noticed all my weight loss. He's
really
hot, yes. He's like, you're looking good. And I was like, thank you. In my mind, I'm like, so are you. But I'm not at that kind of gym.
Would you like to go for a Starbucks?
Right. Well, meet me in the steam room for a Starbucks. That may mean a whole different thing depending on where we are. But
probably a different podcast.
Different, yeah. I mean, it could be this one, but yeah, a different one, definitely. But yeah, no, I would like you had said. So rounding everything back out, do your research.
Yeah,
don't be afraid. Don't care what people think. People ask me, I had this surgery. I don't care what people think about it. I'm happy with how my results were, and I'm happy that I did what my surgeon said, right? Drank the water, and that's for any healing wound, right? Follow the rules, lots of protein,
Good.
So,
well, I think
if
that's
anybody
great.
has any questions about this, write into the pod and ask. As I said, I'm an open book when it comes to my own weight loss.
Absolutely.
100%.
I think, we are blessed and happy, and with, the amount of people that are listening to us and following us over this past season. And
future seasons.
So, really, ideally, we just want to spread our knowledge and hopefully we get people to laugh and understand that this can be a fun space. So please share us and follow us and on all the social medias and anywhere you listen to your podcasts. Until next time. This is Amy
and Ben
on The Heavy Truth.
Bye.